Hi everyone, my name's Nathan and I'm from the European Pain Federation, and today I'm joined by Professor Claudia Sommer, and hopefully we're going to give you some more information about their plenary session at this year's EFIC 2023 Congress, which is held in Budapest this year in September. Claudia, welcome.
Thank you for having me.
No problem. Thank you for joining us and obviously taking time out of your busy schedule. So yeah, just to get us started, do you want to sort of introduce yourself? Let us know a little bit about who you are.
Sure. So, as you already heard, my name is Claudia Sommer. I work as a neurologist, as a professor of neurology at the University Hospital in Würzburg in Germany, and my main clinical focus is peripheral neurology and pain, of course. I have served as president of the German Pain Society, and I have also served as president of the IASP. So now I'm the immediate past president of IASP. In my research, I'm fascinated by unexplained phenomena, unexplained diseases, and one of my aim is to contribute as much as I can to their understanding. These are often people who think they are not understood by their doctors, like people with the fibromyalgia syndrome. And this is the kind of problem that I try to help with.
Amazing. So you might have touched a little bit on that. What's going to be the focus of your session this year?
Um, this is going to be a debate, and the subject is personalized treatment in neuropathic pain and how to identify, stratify responders. So there will be several speakers, of course. You need more than one person in a debate. And my part is going to be to review biomarkers. So the question is, how do biomarkers help in clustering patients with neuropathic pain and in identifying responders to treatment? So I have worked with biosamples from patients with neuropathic pain for many years. And it's both frustrating and encouraging. There's no easy answer as yet. We do find differences in those biomaterials from the patients between patient subgroups, but at present, it is still difficult to identify a pain-specific phenotype versus a disease-specific phenotype. This is challenging. But I'm going to talk about new methods that may help us to overcome this dilemma.
Amazing. And I'm sure that's going to be a hotly discussed debate. And obviously, you mentioned there that it's a group discussion. In the talk, we do have Professor Didier Buhasira and Professor Ralph Barron, who will be joining you. So there'll be three of you obviously facilitating that discussion, which will be great. And I'm sure the audience will be able to get involved in some way, shape or form, whether it be during the session or after as well. So yeah, fantastic areas to cover. So just a little bit of a quick question, just perhaps to explain a little bit more about what you mentioned. Could you perhaps describe sort of the hotly contested, for use of a better term, areas in neuropathic pain, and that obviously that warrant these types of discussions, and perhaps why are they the main focus at the moment?
Yes, so there are different approaches to classifying, identifying subgroups of patients with neuropathic pain, and there's the disease approach, so a patient with a diabetic neuropathy versus a patient with postherpetic neuralgia. Then there's the phenotype approach, a patient who has constant burning pain in contrast to a patient who has allodynia or attacks of electrifying pain. So some people, maybe some of my co-speakers, would argue in favor of these methods. And I will argue in favor of the biomarkers. For example, in this patient with burning pain, this patient's keratinocytes produce the protein so-and-so, which sensitizes the C fibers. And if I know this, and if I know which protein it is, I can antagonize it with my product. And that would be a very personalized approach. So this is my belief and my area, but of course the debate will be, is this true? Isn't this an illusion? Shouldn't we just look at the patient, as I said before, at the phenotype of the patient? And yeah, this is, I'm looking forward to it. It's going to be a really interesting debate.
Yeah, for sure. And you need people with opposing views, or at least understanding those opposing views, and you can discuss. And again, I'm sure all three of you will have in some way, shape, or form, you'll be able to facilitate a great discussion about the topic anyway, regardless of beliefs and stuff. So it should definitely be one that people check out. And you might have mentioned it a little bit before, but why should people come to watch this debate?
Well, they should definitely come. A debate is always fun. You get a lot of information, like in a standard talk, but you may get it in a more entertaining way, which is good. There will be some very good speakers. You have mentioned their names. They are excellent. They know their field. They know their didactics. So you can expect a lot from those. And more back to the content, the audience will hear about the subject from all sides. It's not going to be one-sided. And then they can hear it all and they can form their own opinion, which is a very important process, whether you're learning about a subject, if you're a younger participant, or you want to refresh your knowledge and test your own knowledge and opinions with those of the speakers. I think a debate is good for many of these things.
Mm-hmm. It's certainly one of the better ways to go about it, especially if it's nice and everybody contributes in whatever shape or form that they can do. Yeah, certainly. Well, hopefully that gives people a little bit more information. Again, Claudia, thank you so much for taking time to give us a little bit more information today. And again, kind of goes without saying, there's some really interesting topics that will be covered, and I'm sure the debate will do that in a very entertaining way, as you've said before. But yeah, thank you for taking time today, and we shall see you at the Congress this year.
You will. Thank you. My pleasure.